Dr. Antonucci, I have seen out there advertisings by doctors saying instant implants, whatever, one-day implants. Come in, walk out with an implant the same day. And at the same token, many or most doctors keep saying that, on an average, you put that metal or that, titanium rod in the mouth, you let it sit 1, 2, 3, 5 months, it depends on the situation, I guess, and then you put the crown on it, the prosthesis as you call it. So what is it about this instant implant? Why would anybody want to wait 6 months if you can do it right away? Is this a gimmick? Is it a new technology which is like up and coming and everybody should know about it? Can you tell us about it?
The answer is it depends. Everybody is different in terms of their own particular situation. Some patients can have implants right away. Some patients can't. It depends on the strength of their bone. It depends on their own physical condition. There's many factors that we have to consider and that we look at. The entire question comes from the way that implants were done in the past, where it was a protocol to wait. Until we realized that, the body can heal without waiting. But there are certain factors that have to be right. So when a patient says, "Can I have immediate implants?" my answer is, I don't know. I really need to examine you to see if you're a candidate for it. If you are, it's a great thing to be able to do within that day or within the course of a week instead of having to wait 3 to 6 months. But to believe that every single implant can be done that way, it just unfortunately isn't true.
Okay. So basically, those advertisings, when a patient walks in, the doctor might then say, "Oh, well, unfortunately, you don't qualify for it, so you need to be waiting and let it settle." Like the way we build a house, you kind of like, build a foundation, you let it dry, you let it set, you wait for some cracks to come up, and then you build the rest of it. Otherwise, everything gets cracks. Is that kind of like what you're trying to say? Some people don't have the strength in the bone to right away support the whole tooth?
Some people's bone is very weak. It's like some people's bone is like a piece of pine wood. Other people's bone is like a piece of mahogany. So it's like if you ever put a screw into pine, you know that that's very soft and it goes in very easy. You put it into mahogany, it's very, very hard. If your bone is soft, then we have to wait a period of time for the bone and the implant to really become one. If your bone is very hard, then the mechanical strength of your bone will hold that implant during the healing phase. And that we don't know often until we either do a special set of x-rays or sometimes when we actually place the implant into a person's mouth.
Mm-hmm. Okay. But you would obviously know that. So basically, if a person comes to you, he wants a one-day implant, maybe it's doable, you will let him know. If it's not doable, you will let him know he may have to wait a month or 5 months, whatever it is. But so let's assume he has to wait. Does he have to walk away with an ugly mouth? Or, let's just say he wants that one-day implant because, his only and most beautiful daughter is getting married on the weekend, and it's Monday. And you cannot do that one-day implant because his bones are soft or whatever the situation may be. Can you still make him look good for that one day?
Well, there are many options, and that's part of the whole implant process is figuring out and deciding on how you're going to make a temporary or an interim type of a prosthesis, how the patient's going to go home. Patient has to leave with teeth. And there are many options available to us. It just depends on which direction that we go.
Okay. If he's not qualifying for that one-day implant, obviously the tooth was missing, and you can, over those 1, 2, 3, 6 months, whatever he has to wait, you still can make him functional and looking okay, and so the difference isn't really that huge, right?
The patient will never leave without teeth in their mouth, no matter what. No matter what the situation, it's very rare that a patient would leave without teeth in their mouth. And I think the patient has a right to expect that, and the doctor has the responsibility to provide that.
Wonderful. Wonderful. Well, that tells us about instant implants. They do exist. All right.